So I'm Dr. Dan Catona. I am the owner of this practice here for Moody Smile Dental. We've been here for 5 years, but I've actually been doing dentistry for almost 20 years. This is a third practice that we have, and we try to keep the same vision throughout all the iterations of the 3 different offices. Just a small, intimate, family-oriented kind of practice. I know the names of pretty much all of my patients, even though there's thousands of them. And this is how I foresee that we're going to be doing this forever, really, until we can't anymore. So as far as Invisalign goes, I got into it pretty early. This must be almost 15 years now that I've offered Invisalign. And I've done a lot of cases, I've studied a lot, and I've pretty much tried everything that there can be tried on the outskirts of the Invisalign proper to help it along. And almost, I'm not going to exaggerate if I say almost every system of accelerating the treatment, of making it more predictable, literally anything out there. And while all of them have their benefits and none of them have proven to be something horrible, nothing up until now was truly smooth and predictable and offered exactly what they said they would until Avo. And I've tried it on a number of very difficult cases that I may not have had the courage to touch in spite of, extensive experience in Invisalign. And the results were dramatic. And cases were smooth, predictable, and much shorter than they would otherwise have been. So it wasn't 1 or 2, it was literally every case that we've tried worked perfectly. Obviously the Avo system adds 1 extra little step, but it's such a minor step. Just a few minutes using an appliance that's pain-free, not really difficult a concept to understand. But it's very easy to explain to patients that this will make your treatment more predictable and almost halve the time that you are going to be in braces or Invisalign. So that's easy a concept to understand for the patient, and how great the benefits are, and that it's very easy and to use, very friendly as far as explaining how it goes. It's just a few minutes of one of my assistants going over a few minor instructions, and there you go. They can start using the Avo. So far, the Avo system that we use, as far as the benefit to the practice, is it really sets me apart as to the quality of cases and finishes that I can provide. As I said earlier, some of those difficult cases were truly difficult. So now I am comfortable taking on a number of cases that I would otherwise not have, and that most people would actually probably not touch, and they were life-changing. At the end of those cases, almost every one of those patients cried, and they actually looked, felt, behaved differently than they did at the beginning. It's one of those moments that truly you see, in a profession like mine, you do something and you have that instant gratification. This was one of those moments. It's with each and every one of these patients. So, but not only that, not only the difficult cases, to be able to offer the option, at least 2 patients of a more predictable and shorter treatment for not an exaggerated addition to the fee, is really a game changer. Very little time, a fraction of the cost, and really no side effects, no compromises to achieve great results. It's really a new era in dentistry.